Taiwan is now reaching the other side of its COVID surge, which has claimed the lives of 675 people so far. On Monday, the CECC broke down the numbers of Taiwan's COVID deaths. As of July 4th, the casualties' average age was 73 years old. More than 90% of all casualties had underlying diseases. About 10 to 20% of the deaths resulted when family members refused invasive treatment for their loved one to spare the patient more pain and suffering.
As a matter of fact, the case fatality rate has been in a continual decline. It has now fallen below 1 percentage point.
According to CECC Specialist Advisory Panel convener Chang Shan-chwen, 675 people died of COVID-19 between May 11th and July 4th. Today, the fatality rate is below 1%, after peaking at 6.7.
This high figure came about mainly because we had a large number of cases emerge. In addition, nearly 20% of cases became severely ill, and we needed intensive care facilities. Most hospitals don't have any negative pressure isolation wards. This is the case all over the world.
Among the fatalities, the average age of the deceased was 73 years old. Men accounted for 64% of the cases, and more than 90% of all cases had underlying conditions. Among infected people 60 years old or younger, the death rate was less than 2%. According to the CECC, 10 to 20% of COVID deaths resulted when intubation was refused by the patient's family to prevent more patient suffering.
COVID-19 病人最后往往会有严重的肺炎、呼吸衰竭。
COVID-19 cases often end up developing severe pneumonia and respiratory failure. After intubation and after proper care and treatment, of course it is quite arduous. For a frontline medical staff and nursing staff, it is very arduous. But there is a considerable proportion of patients that can be saved.
In Taipei City, more than 60 COVID patients received monoclonal antibody treatment, which is used to prevent severe symptoms. It worked for nearly all the patients, with a small number presenting mild pneumonia. Only one case became severely ill, although this patient survived. At present, patients are receiving monoclonal antibody treatment at public expense. To qualify, they must be at least 65 years old or suffer from chronic conditions. The CECC says that timely intervention can make a critical difference in patient outcomes.